cancers are preventable, and this offers the best long-term strategy for the control of cancer. We can classify prevention into three: primary, secondary, and tertiary. Primary prevention is the prevention of cancer. In primary prevention, the cancer hasn't occurred at all. So you are trying to prevent it from occurring by removing the exposure to the carcinogens or those agents, or modifying the factors that are associated with cancer. Lifestyle modification that ensures a healthy diet, regular exercise, reduction in alcohol intake, and the elimination of smoking is one of the best prevention strategies for cancer control. Lifestyle modification can also reduce the risk of developing other non-communicable diseases like diabetes, cardiovascular diseases, heart disease, and high blood pressure. Now, the modifiable risk factors are tobacco use, being overweight, so we need to keep our weight normal, unhealthy diet with low fruit and vegetable intake, lack of physical activity, and alcohol use. Now, part of the awareness campaigns that we're making is for people to understand these are the issues that when you stick to them, your risk of developing cancer is very low. And on that note, I'm inviting everyone to come for the cancer trek we're doing on Saturday from Mobile, from Rapper office, that's around that St. Michael's Church area, down to Mobile roundabout, although we're trying to convince everybody to go all the way to Tunga roundabout. The idea behind the walk is to emphasize how exercise can drastically reduce your risk of developing cancer, any type of cancer. You know, exercise, good diet with fruits and vegetables, and the avoidance of the very bad kind of diets. That is an important aspect of cancer prevention. Some of the other risk factors include sexually transmitted HPV, that's human papillomavirus, the one that causes cervical cancer, infection by hepatitis B virus. There are vaccinations available. It is now part of the national immunization schedule that babies have hepatitis B 3 times at intervals for the prevention of hepatitis B. And even as adults, if you have not had it, I encourage you to have it, please. Then ionizing and non-ionizing radiation, avoid too much sunlight, exposure to sunlight, and then indoor smoke from household use of solid fuels. So those cooking with firewood is a risk factor if we can avoid it as much as possible. Look for other alternative energies. Now this is a diagram that shows the way to prevent cancer. You have cancer prevention in the middle. You have control of weight, diet, and physical activity. Now, the elimination of tobacco smoking is the most significant modifiable risk factor. Like I said, it's linked to 22% of all cancers. And the reduction of alcohol or elimination of alcohol can reduce the risk of alcohol-related cancers of the mouth and the pharynx. Now, studies have shown that diets that are high in fruits and vegetables may have a protective effect against cancers of the lungs, colon, breast, cervix, esophagus, oral cavity, stomach, bladder, pancreas, and ovary. These cancers, there are quite a number. By eating diets high in fruits and vegetables, you can actually prevent them in 1/3 of cases. It has been found that people who take low fruit have twice the risk of developing cancers compared with those who have regular intake. Personally, I'm not a fan of fruits. The only fruits I like are mangoes and maybe melons. But I have had to force myself to be taking fruits because of this. And they're very, very healthy. And most people actually like fruits. So it should form part of your regular diet. Now, the exact reason why these fruits and vegetables prevent cancer is not known. But it has been suggested that it has some vitamins and minerals that are linked to the protection. And they do this by The harmful chemicals that our body, for example, if you have an unhealthy diet, some of the harmful substances that are released in your system can be mopped up by the vitamins and minerals that you get from the fruits. In addition, these vitamins help in protecting the DNA itself from getting damaged, and they also help in repairing the DNA when it does get damaged. Then it also has the ability to block the formation of cancer-causing chemicals. You know, I was explaining earlier, you have something called pro-carcinogens, the metabolites that can be developed in the body. Now, the fruits have the ability of blocking the formation of these pro-carcinogens. So these are very important aspects that you need to keep in mind. Then, oh, this picture is not very clear, but it's a picture of the kind of foods a person should that helps to prevent cancer. Even if it's not clear, there's something that is notable. If you look at it, majority of it are what? Green or red. This is rosemary. It's a vegetable. This one is a spice called turmeric. They are all very available. This is tomato. This is garlic. This is pepper. You have broccoli. You have cabbage. You have, this is, what's this one now? I think it's avocado here, you know? You have carrots here. So there are things that are readily available, but anything green leafy vegetables, they contain a lot of minerals and fibers and vitamins that are very protective. Then we go to the types of bad foods that can increase the risk of cancer. Consumption of red meat or preserved meat has been associated with the development of colon and rectal cancer. Yeah, so meat, this meat that all of us like to eat, beef, goat, ram, what else? Cow is beef. Those ones, they contain a substance called heme. Here, it's a pigment that, you know what gives it the kind of color? It's called heme. Now, this has been found to irritate the bowel, and that irritation leads to kind of inflammation that can lead to increase the risk of cancer. Then you have frozen foods, frozen beef, frozen pork, whether it's frozen or not. Then you have sausages, bacon, and ham. These ones have all been linked to the increase in colorectal cancer. So those who are vegetarians have an advantage of not developing this one. Now, the top 5 cancer-causing foods. Here, we have what is called hot dog. Now, one of the reasons why cancer is on the increase in Africa or in our own environment is because we have now adopted the unhealthy lifestyles of the Western world. Because if you look at it here, there's no food here that is local to us. This one is hot dog. This one is, sorry that the pictures are not clear. They look clear on my computer. This one is processed meat, like bacon and sausage. This one is donuts and cakes and cookies. This one is French fries, that is potatoes that are fried. And then this one is cookies. These ones are cookies and biscuits. If you look at it, our people in the village, they eat this kind of things. They don't. And we have before, now things have changed. Before, we didn't used to have cancer of the colon as much as in the Western world because we eat our normal foods that have a lot of fiber. Our dawa, our masara, our corn, the way we eat it with the husks allows us to have normal bowel habits. Constipation is one of the, chronic constipation is one of the risk factors for developing colorectal cancer. And the reason why in the developed world they have it is because they don't take enough water, they take a lot of processed foods. These foods remain in the intestines, causing damage, and this can lead to cancer. So eating our normal local foods, plenty of zogale, I don't know if that's moringa, right? Yes. Moringa, all these our normal foods in the villages can protect us from getting all this. However, we also have to know how we cook them. A lot of our cooking habits kill the nutrients again. So you will not have the nutrients that are protective. So something to note. So these are the 5 top cancer-causing foods: hot dogs, processed meats, bacon, donuts and sugary foods, and fried foods like French fries. Other measures that can prevent cancer include vaccinations against hepatitis B and HPV, reducing exposure to physical and chemical carcinogens, and so on. Now, regular exercise can reduce the level of hormones in the body, and that is why it has been associated with a reduction in the development of cancers. So it reduces estrogen levels, it reduces insulin levels, and so it reduces the risk of those other cancers. Secondary prevention. In secondary prevention, the disease has already occurred. So the person already has cancer, but you can prevent its progression. So, or it's either the person has cancer or the process has already begun. If you remember what I said, that it takes some years before it can occur fully. So in secondary prevention, you are aiming at catching it at the very early stage or at the pre-cancerous stage, where you have the signs of the cancer coming up, but it hasn't become cancer yet. Now, even though 1/3 of cancers are preventable, the remaining 2/3 will occur, even if a person has a healthy lifestyle. So the earlier you detect the cancer, the better. There are two main early detection methods. One is early diagnosis and the other one is screening. Early diagnosis involves people being aware of early symptoms, and we have just discussed some of that. Having knowledge on the symptoms of cancer will allow people to present themselves for examination, increasing their chances of detecting the disease at the earliest stages that will ensure cure is achieved. The second is the screening. Now, screening is actually looking for the cancer before the symptoms have occurred. The two best examples of how successful screening can be are with breast and cervical cancer. In most cases, you cannot screen, it's difficult to screen for cancers, but for breast and cervical, one can screen for it. With breast cancer and cervical cancer in the developed world, the screening programs have significantly reduced the incidence of both breast and cervical cancer, especially cervical cancer. For us in Nigeria here, cervix is the second to breast. While in the developed world, cervix is like number 5 or number 6 because of those screening programs that they have. Now, for breast cancer, a screening test called mammogram is the one that has said to be effective in detecting early cancer. The mammogram is a type of X-ray that is done to take a picture of the breast. It gives you images of the breast that is able to show you whether there is a tumor there that can be cancerous. And based on the way it looks, you can tell whether this is a cancerous one or not a cancerous one. It is recommended that any woman above the age of 40 should have a mammogram at least once every year or once every 2 years. For those who are less than 40, between the ages of 20 and 40, they should have regular ultrasound scan of the breast. Please note, breast cancer occurs in men also. Yes. It is more in women. Breast cancer is more in women because women have bigger breast tissue. And that is why it is more, one of the reasons that has been postulated that it is more in men, but in women. But men also come up with breast cancer. So men are also supposed to have screening exercises with mammogram. Now, the other screening methods for breast cancer include clinical breast examination and self-breast examination. Now, the clinical breast examination is the examination, let me start with the self-breast examination. The self-breast examination is a step-by-step approach that a woman can use to examine her breast in order to detect any abnormalities. Now, even though this self-breast examination has not been proven to be effective in early detection of breast cancer, what it does is that it allows the woman to know what is normal for her. And when she knows what is normal, as soon as there's an abnormality, she will note it and she will go to the hospital. It is recommended that a woman does that self-breast examination once every month, and usually within either a few days to her menstrual cycle or after her menstrual cycle. And the reason is because the menstrual cycle is what? Constant. So you won't forget. Okay, so you won't forget. You'll be able to do it once every month. And the idea is you stand in front of the mirror and examine. There are specific ways in which we're supposed to do this examination. And on this note, I'm inviting everybody to come for the free screening exercises we're going to be doing at the Race Foundation office between Monday, Tuesday, next week, Monday, Tuesday, and Wednesday. Monday, Tuesday, and Wednesday next week. And what we're going to be doing is a clinical breast examination. Now, the clinical breast examination is like a self-breast examination, but it is performed by a trained professional. That trained professional is going to be able to detect if there's a problem in the breast, which ordinarily you wouldn't be able to by yourself. It is recommended that you have one at least once every year. So please, anybody who is here is kindly invited to present themselves to Grace Foundation office in Okada Road for that clinical breast examination. We're doing it to detect as many cases as possible, and we're hoping anybody who we detect with an early stage would have been able to save them from a death from cancer. And we shall be able, by the grace of God, to treat those people who we now find to be positive. So please, bring your thoughts. So, and then when you are there, we will be able to teach you how to do the self-breast examination. I would have done it for you now, but honestly, there's no time. But it will be good that you come and you see it yourself and then you learn. The last time I gave a lecture on this, I was happy to find out that there were women who are actually doing that breast examination every year. I would encourage everyone to do so too. So the clinical breast examination, in combination with mammogram, it's one of the best ways of screening women and detecting early cases of breast cancer. For cervical cancer, the screening test for cervical cancer actually detects the pre-cancerous stage of cervical cancer. The good thing about cervical cancer is that the precancerous stage can last up to 10 years without it becoming cancerous. So the most common screening test that is done is called a pap smear. And that is recommended for any woman who is sexually active. Now, for cervical cancer, because it is linked to a sexually transmitted virus, girls who are not sexually active, nuns that are not sexually active have been found not to develop that cancer. So it's associated with sexual activity. So whether you are married or unmarried, but you are sexually active, you need to have a cervical cancer screening. If it's pap smear, you're supposed to do it once every 3 years. The pap smear is a test that involves taking a sample from the cervix and examining it on the slide. It tells us what stage of precancerous lesion you have, and we're able to offer the treatment. Now, the pap smear is quite expensive to do because you need a pathologist to come and check the results and so on. So we don't have a regular screening program in Nigeria at all for cervical cancer. Now, what we are aiming to do is start one here in Niger by the grace of God. And we have started, what we have started is we are doing a cheaper version that has been found to be equally effective, both for women in the rural areas and for women here. And what we do is we call it visual inspection. Instead of using a pap smear and taking the sample to a pathologist, what we do is we paint the cervix with a substance that colors an abnormal area for us. We have found that something called acetic acid can paint an abnormal cell white. So we're able to detect women who have a precancerous region, and then we're able to treat it at that particular time. And then HPV DNA detection. Now the HPV, that is the virus that is associated with cancer of the cervix. Now there is a test that is able to detect the DNA of the HPV within the cervix of a woman who has chances of developing cancer of the cervix, and that helps treating the woman. An important prevention tool for cervical cervix is the availability of the HPV vaccination. It is not widely available in Nigeria, but very soon, by the grace of God, it will be. Now, the important thing about this is for people who have not been sexually exposed yet to have that vaccination. That will now cut off the incidence of cervical cancer. So with HPV vaccine, our aim is to give children the vaccination. Girls, they have not approved it for boys yet. The men are afraid it's going to cost something to their boys. So they have not been able to get full approval for use in boys, but in some areas it's being used for boys. But the recommendation is girls between the age of 9 and 22 should have that HPV vaccine. By 9, we don't expect girls to be sexually active. So once they have the HPV vaccine, even when they become sexually active, they won't catch it. The reason is because the HPV virus is the most proliferant sexually transmitted disease. If you have a population of 100 people, 90 of them would have HPV, men and women. So the virus is quite easy to acquire. So usually within the first contact, sexual contact, a person can get HPV. But what the HPV does, it's not all of them that will cause symptoms that will make you think you have it. What it does, it goes and remains in the DNA of the individual. And for women, it now transforms the cervix into a precancerous and then a cancerous lesion. So I'm encouraging all of us here, if we have children, girls that are less than, in fact, girls that are less than 22 years old, please, if you are able to get that HPV vaccine, it's not available in Minna right now, but you can get it in places like Kaduna, Lagos, Kano. I encourage you to have them, to get them vaccinated against it. Tertiary prevention, at this level, the disease has already happened, so what you are trying to do, and you've already treated it actually, but you are just trying to make sure that you have alleviated the impact of the disease on the patient's life. So usually what we say is palliation is given here, making the patient more comfortable, not having any pain, and so on. So we are not aiming for cure here, we are just aiming to make the person's life better. So we have finally come to the end of and it's associated with aging. Now the importance about this topic is, it says aging gracefully. Now, when you modify those risk factors, you will definitely age gracefully. You have a good, healthy diet, you are exercising regularly. People who exercise regularly are able to exercise even in their old age. And the more you exercise, the more So the takeaway here is, number one, cancer can be preventable and it can be curable if detected early. So the takeaway here is, please be more aware, get more information, and then disseminate this information to other people. Join hands so that we are becoming more aware of what cancer is. One of the problems we have in Nigeria is that in Hausa we call it chiwandaji. You will see a person who is actually educated who will not go to the hospital. Will say that chiwandaji was given to him by somebody out there. Somebody, no, it's the truth of the matter. It's either my enemies have been, somebody at work wants my promotion. That is typical, I'm talking from experience. The second thing is, they will now go and meet a local imam or a priest that will tell them that prayers is enough for them. Or this local medicine man will say, if you put a needle in that place, you are dead. So women do not begin with things like breast cancer, like today, like just this week now. I have the unfortunate incident of seeing a girl who has most likely cancer of the bone. This was discovered 2 years ago. When she was told that they were going to amputate it, they left the hospital. And they now started seeing a local medicine healer. Now the tumor has become as big as this computer. And she can hardly walk. And they're still going to amputate the leg. But the difference now is, at that time, it was not spread, it was just on the knee, and it was just a small swelling. Now, it's likely that she has, there are misconceptions, and very unfortunately, people die unnecessarily. So please, I would encourage everybody to take the time to understand this thing. I hope what I have done has clarified a few issues, and I'll be quite happy to answer some questions. But please, spread the word. Cancer can be cured. Thank you.
I think we can do it on that. Let's do a very short round of applause, please. Lecture.
Distinguished ladies and gentlemen, I noticed some things. When the lecture started, the hall was lively. But by the time she went to the heart of the matter, everybody became sober. By the time she said, men can have breast cancer, people remember, I was don't feel like it. It has been a wonderful afternoon. We have learned quite a lot of things. And all of us will have one thing or the other to take home. She spoke for 85 minutes. She spoke for 85 minutes. None of the minutes is wasted. They are packed with messages. We want to thank you, ma'am, for the disposition. It has been very wonderful. We have really profited. She has gracefully agreed to take few questions. Today is very busy. We don't mind keeping her here till evening. After this event, we have invited her to a live program. We have the opportunity of listening to her. She has some questions to answer live on her FM station. So from here, she will go to the FM station so that people in town up to Lambata can benefit from the gist of this. Thank you very much. We will take very few questions. Please, we will not restrict the question to women. Let your questions be brief, to the point. If the first person say what you want to say, please don't say it again. I will start from my right.
That interesting and enlightening talk. At the end of it, I don't know whether I'm happier or sadder, but I console myself by believing that knowledge is power. My question relates to liver cancer. There seems to be a high incidence of liver cancer in Nigeria. And as far as I can see, we're not an alcohol drinking, tobacco smoking country. Why is this so? Thank you.
Mine is not a question, but a suggestion, I think. I want a very quick background. At the beginning of this year, the Vice President represented the President at the AU meeting in Kigali, Rwanda. He said the population of Nigeria had reached, in January this year, 185 million. Out of the 185, 110 are poor. Out of the 110 that are poor, 150 are chronically poor. The evidence of poverty is in all our slums. That is the way they are growing and expanding all over the place. Two issues came to mind. First of all, when you talked about, remember you mentioned firewood. We all started laughing. Firewood is too expensive. Charcoal is the in thing now, because that's what people can afford. But it has expenses. I mean, deforestation and the kind of fuels and so on people are negating. That's one story. The second story is a pure water problem that we're dealing with. Amina here, from the two studies we carried out recently, we produce, and I imagine sell, between 1.2 and 1.8 million sachets a day, depending on the weather. The plastics they house this in are extremely flimsy. And the argument is that as soon as they're exposed to the sun, again, I don't know how high the density will be. They become the air, the water, and so on, all kinds of things. These people in the slums, and I assure you most of us too are facing the same challenge. That's about the only source of water we have at the moment. And we're not really exposing these people to higher level of chances of catching it. So my suspicion is that since it's not possible for us to get rid of slums overnight, but your esteemed foundation can help by educating those who produce this pure water Essentially, the problem starts as soon as they produce it. Everybody is the member that produces an idea to the best of my knowledge. And we need to see the conditions. As soon as they produce it, they get rid of it. Those who retail it, they keep it for hours in the sun, for days sometimes. Those who buy it can only buy one bag at a time. That's they are even able to. So these are issues that probably we need to begin to address until we can find a sustainable solution.
High table. My names are Chief Abubakar Bello, Minister of Education. We are really very enlightened with your lecture. And I know maybe if you agree, we will allow you to give us more lecture in this school. The first one is an advice. With a privileged position now, we have law against tobacco smoking in the public. How can it be enforced? Because we discover those who are smoking tobacco in the public, most of them smoke hemp. And if we tell them to stop it, they will slap you. Please, we want this race Foundation Nigeria to do something with your privileged position as the First Lady of the state. And the wife of the Speaker is here. We don't want any only law. We want enforcement. That's number one. Here, 10% of this audience are very comfortable because they have the wherewithal to fight cancer. 90% of us are challenged. Now, how can we encourage our employers, whether private or public, to empower us so that if we cannot be cured in Nigeria, we too can go overseas?
Towards attainment of health livelihood for all. However, we urge other countries like ours was able to overcome it due to access to health services, counseling, public awareness. So, what recommendation would that we should embark on vigorous awareness Graceful through our local languages?